All right, let's get started. Welcome officially to everyone. Thank you for being here. It's great to have you all with us this morning for the LA Partnership for Early Childhood Investment quarterly meeting. I'm Parker Blackman. For those of you I haven't met, I'm Executive Director. It's really nice to meet you over Zoom. And good morning to those of you just saying hi in the chat box. Good morning to Jeff and Araceli and Shamika and David and others. Feel free to chime in and just put your name and affiliation there. I am going to just run through a couple of quick sort of housekeeping things here right at the top, and then get us quickly into this exciting conversation. So, as I said, I'm Parker Blackman with the LA Partnership. Those of you who haven't been in these meetings before, we're a public-private partnership, philanthropy and public agencies with a mission of catalyzing philanthropic investment for systemic changes that benefit the most vulnerable children, birth to 5, and their families in LA County. And we have more than 20 philanthropic partners and folks from all different parts of the kind of public sector, from school districts to cities to county agencies. So it's thrilling to have such a vibrant partnership. And one of the things that we do every quarter is we have these meetings where we bring together a set of leaders, like the folks who've been kind enough to join us today, to talk about an important issue in early childhood, and not just to learn about it, but to do what we call educate for action. Meaning, what are the opportunities for philanthropy to partner on this issue to try to actually accelerate systemic change with an equity for justice kind of lens for the most vulnerable children and families. So that's the partnership. I want to thank a couple of folks for helping to make this meeting happen today. First is our friends at Southern California Grantmakers. They partner with us on all of these quarterly meetings. They share it broadly with their list and help us with the operation of this meeting. So thank you, Southern California Grantmakers. You are continuing to be wonderful partners. And of course, Mary Kopp, Operations Director for the partnership. Mary is really the glue behind all of this. These meetings do not happen without Mary's leadership. So Mary, as always, thank you so much. I just want to thank our speakers for joining us today. I will let our moderator formally introduce them, and you all should have received their full bios in advance. So we're not going to spend too much time doing deep introductions. But here's how we're going to do this. I'm going to turn it over to Aurea here momentarily, and she's going to ground this conversation for a few minutes in the topic, and then talk with the leaders of each of these initiatives about why they got started, what they've learned from them. And then at some point, we will open this conversation up to all of you. At any point during this, you can use the Q&A box on your screen to pop in a question or a comment. And then that way, Aurea will have those when it gets time for us to open this up to the broader conversation. Microphones will remain off for the entirety of the program for all guests except for the speakers. So the Q&A box is exclusively the way to make a comment or ask a question. So with that, I do want to thank our moderator. Aurea Montes-Rodriguez is Executive Vice President at Community Coalition. And for this conversation about the importance of public-private community partnership, I honestly can't think of a better person to moderate this, given her wisdom of experience working in community in LA County. She just has so much knowledge and experience that I know she'll bring to this. So Aurea, thank you so much for being here and for agreeing to moderate this conversation. I'm going to turn it over to you.
Thank you, Parker. I received the invitation from Casey and just, saw all of the individuals that have been invited to participate in the panel, and there was no way that I could say no. I am thrilled to be here with all of you this morning, and I want to welcome all of you to this conversation, public-private community partnerships, putting equity into action. And the action part is really what I want you to keep in mind, because all of the women that you are going to hear from today have spent decades working to center the needs of some of the most important individuals in LA County and families in LA County in the work that we will be discussing. So it's an honor to be here. I work at Community Coalition, a social justice organization based in South Los Angeles. We were founded in 1990 to deal with the impacts of the crack cocaine epidemic. And for 30 years, Community Coalition has worked to transform the root causes of social and economic conditions that foster addiction, crime, violence, and poverty by building a permanent community institution that centers the voices and leadership of Black and Brown residents, including youth. And I wanna lift up young people because the devastation of the crack cocaine epidemic has taken decades for us to address. And the pandemic that we are going through is a reminder to all of us of the origins of our organization and the work that lies ahead of us. For 30 years, our organization has been multiracial, Black, Brown, and intergenerational in all our work. And we employ different strategies with community organizing at the center because we know firsthand that it's the people closest to the issues who know what is best for their communities. And I want to really emphasize that because I think that it is going to be a theme that you are going to hear from the panelists when we talk about public-private community partnership and equity. I also want to lift up that our organization, some of our founding members are actually social service providers, folks that were on the front lines during the crack cocaine epidemic, meeting some of the most essential and critical needs of community residents who otherwise would have been left behind, especially impacted by mass incarceration, by addiction. And, some of the services that social service providers who helped to found and build up Community Coalition were providers offering substance abuse treatment, mental health, employment training, transitional and supportive housing services for mothers and children. And, unfortunately, early on in my time, I got here right after college in the late 90s. And we learned in the late 90s that oftentimes organizations that were Black-led and that were seen as anchors by community residents and families were not receiving funding to do the essential work that they were providing. And not only were they not receiving funding, they actually were not receiving support to build out their capacity and their infrastructure. And, I want to lift that up because today you are going to hear from Black women that are leading two Black-led, Black-focused initiatives that are really challenging the premise that these organizations were not deserving of investment and funding. So into today's discussion, I want to first start with talking about equity and defining it for the purposes of this conversation. And we know that there are a lot of, there's a lot of discussion of equity, a lot of definitions of what it means. But for the purposes of today, I want to think about the LA County Department of Public Health. They define equity as promoting fairness, but it can only work if everyone starts from the same place and has the same needs. Equity means giving everyone what they need to thrive. And, I also want to just pause and say what equity isn't. Equity, in our opinion at Community Coalition, it's not charity, it's not handouts, and it's not an equal allocation of resources. Therefore, in today's conversation, you're going to see concrete examples of groups that have put equity into practice by truly centering community participation, community ownership in the design of all the facets of the programming and work. And it's important for us to have these authentic conversations to inform new ways of partnering together and living into equity and racial justice, because the last year and a half of the COVID pandemic, I think, has both eliminated the systemic disinvestment that communities like South Los Angeles, in the Southeast, East LA, East San Fernando Valley have experienced in the county of Los Angeles. And it's also illuminated the cost of structural racism for high-need communities, right? And we saw that with the disproportionate loss of life, the digital divide, the difficulty of high-need communities in accessing COVID testing, vaccines, basic things like PPE supplies, healthcare, right? We also saw the inequities in distance learning that is actually going to lead to generational widening of the achievement gap. And so I want to remind us of that, because today you're going to hear from phenomenal women who are leading the countywide African American infant maternal mortality prevention initiative, and also from the Partners for Children South Los Angeles. And I actually have had the honor of working with many of these women, but also of helping to found the Partners for Children South LA. And these two projects are gonna help us lift up ways that we can really work differently, because that's what's going to be required of us coming out of the pandemic. So let me start with introductions. And before I start with introductions, I see a lot of friends in the chat who have signed in and shared their names and organizations. Want to welcome you and express love to those of you who have been doing this work also for decades. I'm going to shout out to Nomsa Kalfani, who is on the list. But share your intention. Why are you here? Share with us your intention. What is it that you are seeking, to gain from the session or to hear more about? Because we will have time for dialogue after we hear a little bit about the initiative. So for the African American Infant Maternal Mortality Prevention Initiative, a coalition of the LA County Agency Department of Mental Health, Department of Public Health, and Department of Health Services, First 5 LA, it includes community organizations and healthcare providers, funders, and community members. They're united in one purpose. And the one purpose is to address the unacceptably high rates of Black infant and maternal deaths in LA County. So for this initiative, we have three incredible, phenomenal women. Dr. Debbie Allen, who's the Deputy Director of Health Promotion for LA County Department of Public Health. Sonia Young Adam, the CEO of Black California Women's Health Project, and Casey Patterson, the Senior Director of the LA Partnership for Early Childhood Investment. And honestly, Casey has really been pushing the envelope in terms of, what do we raise funding for? How do we make sure it's getting to the right communities, the right organizations, and how do we unapologetically talk about the Black community and Black leadership? And so again, you will see from all of these women how we are putting our values around equity and racial justice into action. And so I want to start with Dr. Debbie Allen and Sonia. So Dr. Debbie Allen, the first question, and hold on, because can you share tell us a little bit about what the AIM initiative was started, its purpose, and what issues you are addressing. And Sonia, if you can get ready after after Dr. Allen speaks, to talk about, how you came together, the public-private community partnership elements.
Great. Thank you so much, Aurea. And Debbie is fine. I really want to thank the partnership, both, for being gracious enough to sponsor this event, but more fundamentally for, I think, really taking a leap to say that in focusing on early childhood, we really have to focus on the health of infants at birth and the whole birth process. And I think that's a new paradigm for many in the early childhood world, is recognizing that childhood doesn't start at the moment of birth. It really starts with the health of the mother and the health of the whole family. Infant mortality is the crux of the AIM work. And infant mortality is a fundamental public health issue. It always has been, always will be. It's one of the ways we measure the overall health of a society. If you tell me how many babies die, and then you tell me what longevity is for the population as a whole, I can tell you whether there's war in that society. I can tell you whether there's poverty. I can tell you whether there's inequality. And in the United States, infant mortality tells a story of inequality. Fundamentally, it is about racism. In LA, when I first arrived here, I moved here in 2017. And by the way, Parker, I moved from Boston. So if there's a Red Sox Dodgers World Series, I will be, I'll be excited, but torn. When I moved here, the statistics in Boston, in LA, sorry, and if Mary can put up the first slide, I do think it helps for people to see this because it's so vivid. The orange line is the Black infant mortality line. The three lines below are Hispanic, which you can see is the highest of the other three, white and Asian. And you can see the other three are closely grouped together, although in fact, I would point out that the Hispanic rate is twice the Asian rate, although both are relatively low, but collectively those rates are 3 times lower, or 1/3 the rate for Black women. And what you'll see is the rate for Black women has come down very importantly, but the gap has stayed the same. And that's really the story of the last 40 years in which public health has been looking at this. So that is sort of the fundamental starting place for AIM work. And the second slide, if you would switch, tells even more dramatically, and in some ways, this is really the crux of what's going on with infant mortality. This is maternal mortality. We measure infant mortality per 1,000 live births. So we are not saying 10% of Black infants die. We're saying about 10 per 1,000 died in 2018. This is looking at maternal mortality, which is much more rare, thankfully, and we measure it per 100,000. So the issue here isn't the number, the issue is the disproportion. I mean, again, that line for Black women stands out. It's about 6.5 times the rate of maternal mortality for white women, and women should not be dying around childbirth in the United States in 2021. That just should not happen. So this statistic is horrifying. Next slide. So given that this is a fundamental for public health, and given that infant mortality, it's both a marker for how we're doing as a society, and it's a story of personal tragedy, of course, because every baby who dies is a terrible loss for a family. It is also, and this is very relevant to the partnership, a predictor of childhood health, because for every baby who dies, 10 babies are born preterm, and preterm birth is associated with risks even for the surviving infants. There are all kinds of ways we can help babies catch up, but babies shouldn't have to catch up. And in long-term health, being born preterm puts that infant at higher risk, and this is fascinating, of early onset of chronic disease as an adult, because the baby's sort of metabolism is set differently, and particularly that's true around hypertension. The baby is has been exposed to stress in utero and is vulnerable to stress as a lifetime predictor of chronic disease. So when we address infant mortality, we're really addressing the long-term health of the overall population of children as they develop and as adults over the long term. And the picture of inequality we're seeing in birth outcomes is it's the picture of why so many more Black and Latin people died for COVID-19 because of chronic illness as compared to whites. It starts at birth with that difference in risk. Historically, these are the kinds of theories people offered about why we're seeing this. Is it economics? Is it the mother's education? Is it simply because Black women are more typically poor than white women? Is it because Black women may be less educated? Is it because Black women do more things that place the baby at risk, like smoking or drinking? Or is it access to healthcare? And the answer to every one of those questions is no, that's not what explains it. All of those things explain differences within groups. So this isn't saying it's good for a mother to smoke or it doesn't matter. But this is what's saying that when we look at Black and white women who smoke do better in terms of birth outcomes than Black women who do not smoke. And any of us who've had babies know that the first question you get asked by your prenatal care provider is, do you smoke? Because that's the first thing they're going to work with you on, ideally, because it's so dangerous. And the fact that race supersedes smoking as a risk factor is so telling about the impact of racism. Next slide. So the theory on which AIM is based is that there's a pathway, and this pathway, increasingly research has allowed us to really verify that this is what we're seeing when we see these inequalities. That adverse social experience, the day-to-day experience of racism in big ways in your life, losing out on a job opportunity, losing a house, an incarcerated partner, those huge things, and also those tiny day-to-day stressors of racism when you walk into a store and someone follows you around, that all of those things lead to accumulation of physiological stress, and that psychological stress that produces physiological stress in terms of fight or flight, and that cumulative stress ultimately hurts women's health. So the theory on which the AIM work is based is, what do we do to prevent adverse social experience? What do we do to address psychological stress and prevent that from turning into physical stress? How do we help women resolve the stress they experience in life? And then for women who've experienced adverse outcomes, how do we create a healthcare system that is most supportive of Black women, most attuned to recognizing the risks they face and addressing those risks in a positive, supportive, woman-centered way. So there's a whole set of activities that flow from this. There's no silver bullet. There's no one thing we can do. We really have to be addressing all of the activities in this cascade. The county first, there has been a long history of many community groups, including Sonia's and others, that have worked to address these issues for decades. I think what the county can do is provide this data that sort of pins what people experience socially to not simply a personal experience of infant loss, but a social story that turns the personal experience into a social phenomenon that needs to be dealt with at a policy level as well as a personal level. And so this
Dr. I don't mean to cut you off.
No,
is it okay if we pause here and bring in Sonia?
Yes, absolutely.
How the partnership came together. Want to make sure that you all have an opportunity to speak. And I think that this would be a good place for Sonia to share about, the elements that make it a public-private community partnership and what we have learned so far.
Absolutely. Thank you.
Hi there. It means so much to me. And it also raises, my level of emotions, every time I hear Dr. Allen, Debbie, speak so profoundly about, the genesis of the public health department's acknowledgement recognition through data, but not only data, because the data has existed, but through the acknowledgement of the disparity, through the acknowledgement of racism as a core issue. And I say that because organizations like California Black Women's Health Project, yes, but so many others. I mean, if you know Winona Valentine, if you know Yolanda Rogers, if you know the team at Black Women for Wellness, many of these organizations and individuals have worked for decades, really trying to look at the community and support the community during a time when the public health system had not yet, had a level of acknowledgement around this critical issue. So the importance of the community health departments coming in and either having that acknowledgement or doing it because the state, in this case, offered, the state really put an investment, and determined that counties could apply for funding and begin to really uplift this issue, because at the state level, there was a recognition. So I fully acknowledge that as well. But one of the critical pieces of the work that LA County is doing that we value so much, and they're a standout in many ways, is the active, direct, intentional engagement of community members, of community-based organizations to come together to help to define, what solutions and interventions could and should look like. Because what we have been doing on the ground forever, really, is standing in this gap, standing in the gap where there is a lack of culturally, relevant, culturally sensitive services. There is sometimes even just a gap in the availability of care. There is a gap in the acknowledgement and the conversation and having, similar ways of expressing what the issues and concerns are in the community. And those gaps, need filling. And that is the work that community organizations have been doing historically. While we have the women in our community and the families in our community, unfortunately and sadly, blaming themselves or unable to really understand what is happening and why is this happening. And so, we've filled those spaces, but now because of initiatives like the African American Infant Mortality Initiative, we are able to work together with the Public Health Department. And then you have the benefit of, and I thank you, Parker, I thank you, Casey, and the partnership, because you have the benefit of someone, and I'm going to, highlight you, Casey Patterson, because you were aware of this issue, and then in your own role, in your sphere of influence, you were able to bring this issue to the partnership and to be able to come together, bringing, philanthropy into this space, because it's not possible. The public health department, we know, has its own, and forgive me, Dr. Allen, has its own bureaucracy, its own, sort of issues and challenges around, rigid with responsiveness. But bringing philanthropy into this space, created an opportunity for us to work together. And it is an advocacy strategy for me as CEO of California Black Women's Health Project, that I have been beating the table with this issue since I started with the organization literally 7 years ago today. And because I come from the corporate sector, my work was in commercial and investment banking. I have a finance degree. I mean, I come out of a sector where the lack of resources is not an issue. So I mean, and collaboration, synergies, finding those ways for people to work together is like a business acumen. It's a fundamental approach to, what makes businesses, corporations and those types of businesses successful. So I came into this space, into, the nonprofit sector, really intentional about, we can't, there's no such thing as doing this, in isolation. You can't bifurcate intervention. And it doesn't help when the community organizations are working on the ground, and I say working with crumbs, because we are a Black women-led organization, 27 years old, and struggled for all of the terms of our existence with the lack of sufficient investment in this work. Yet we are filling those gaps with our hopes, with our passion, with all, working night and day, and with the lack of really sufficient resources. But we have to get it done because we are responsible for helping to ensure that our community is safe and holding those spaces until there is, the intentional investment and the work with, the public sector, to address those gross gaps in health outcomes.
Thank you.
Aurea, I see you looking at me, so I know that.
Well, because I do want to leave time for you all to have a conversation across initiatives and panels, but just a few things, Sonia. I mean, families, women blaming themselves. And that does not happen because that's where they started. It's because that's what, the county, the broader community has been saying and doing, right? Blaming them. And so building an initiative that sees not just the women, but also the leaders that have been doing the work to better support them. And so with that, Casey, please join in. If you can talk about the lessons, what have you learned in building this initiative? And then we'll bring in the second panel to join us for the conversation.
Yeah, thank you so much, Aurea, for moderating this conversation and for the opportunity to be in conversation with all of you and to sort of demonstrate what this partnership looks like. Some of the key lessons that I've learned over the 2+ years that the partnership has been involved in this work, and some of them I've shared, and over the course of the initiative with our partners, is that the first thing really that I learned pretty early on is that we were sort of having a translation problem that we in the private sector, we in private funding, we sort of have our speak, we have our philanthropy speak. The public sector, they have the way they speak and operate, and community, they have the way they speak and operate. And so what I started to recognize pretty early on is that one of the critical things that I could do in helping to support this work was to sort of see myself as a translator and, to see the importance of understanding that, somebody saying hi and somebody saying hola and somebody saying ciao, and we might be saying the same thing, but the language that we're using is different. The cultural context in which we are speaking is different. And so how do we understand, how do we have a translator to help sort of bridge some of those cultural gaps? And so that was a really important lesson learned. And so for funders who are in the audience today, I think it's so important to understand that when we're talking about these public-private community partnerships, that we really do need to have some dedicated capacity, to help serve as the glue, to bring these efforts together, because we all talk about the importance of collaboration, but it doesn't just happen. You need to actually staff collaboration so that it happens well. The other thing that I would say, was a really important lesson learned, and it sort of dovetails into what I just said around staff and collaboration, is it's so important to invest in trust building. It just simply wouldn't have worked if I would have showed up, and said, okay, so we're the private sector and we've got some dollars and, here's what we want to do with those dollars. And, here's what the public sector has laid out and so on and so forth. It just simply would not have worked. And so I started to learn early on and really change the language around the initiative, because initially we did talk about it as only a public-private partnership. And to me, it was so important that we intentionally infuse the language of community as a co-equal stakeholder in the design and operation of the initiative, because if we don't name the stakeholder, we certainly aren't going to center them. And so it was so important to say, no, this is a public-private community partnership. And so some of the lessons really, and certainly happy to get into it as we get into further Q&A with the audience, because I do want to give time for Liza and her group to speak as well. But really the lessons around investing in trust, staffing collaboration, and the ability of folks to really serve as the glue, and thinking very intentionally about our stakeholders and whether even in our language, we're inclusive of those stakeholders as critical to the effort. So again, happy to share more, but I'll turn it back over to you, Aurea, so you can bring the others in.
Thank you, Casey. And we will, have time to come back. So for now, I'd like to welcome Liza Bray and Phyllis Gridden-Tate and Jacqueline Chun. So Partners for Children South LA is a collaborative of 38 health and human service organizations that partner to provide linkage across and cross-agency care coordination for children birth to 5 and their families in LA County Service Planning Area 6. And so Liza, can you tell us a little bit about the mission of Partners for Children South LA and what issues you're seeking to address? And then Phyllis, I'll bring you, if you can be ready to step in and talk about, the elements of the partnership.
Absolutely. First, I just want to thank the partnership for allowing me to be a part of this very important conversation. But just briefly, Partners for Children South LA, also known as PISLA, we were founded back in 2009, and we've been actively serving families in South LA since 2013, so a little over 8 years now. And our mission really is to look at how we can improve access to high quality healthcare, early education, and family supports for what we know to be some of the youngest and most vulnerable children in South LA. And we do this along with our 38 partner organizations by identifying birth to 5 children and their families to participate in our early childhood system of care. And it's through this system of care that our partner agencies coordinate service delivery to provide high quality, holistic, and reliable care for our families. Our model operationalizes the principles of the Strengthening Family framework, which highlights not just the factors that threaten the well-being of children and their families, but also articulates the 5 protective factors to reducing the risk of child abuse and neglect. So our system of care, it includes everything from intake to triage, assessment, referral, care plans, case management, as well as tracking and evaluation. The children and families have access to all of the partner agency services, including housing, childcare, medical, mental health, and so much more. By providing these critical services and the cross-agency care coordination, our goal is to really look at how to move these children and families from a place of crisis to self-sufficiency. And ultimately, obviously, the goal is to get them to where they're thriving.
Thank you, Liza. And so Phyllis Gridden-Tate, Administrative Operations, Quality Outcomes, and Training Division of LA County Department of Mental Health. I know that you have shared with us that, working in a public, private, public community partnership was definitely an opportunity that you stepped in to support immediately with a long history of working for the Department of Mental Health. Can you please share a little bit about why you thought that this was an important initiative for you to be a part of and to really promote with the Department of Mental Health?
Absolutely, absolutely. I think with the department, we are fortunate, one, because we have the Mental Health Services Act, which allows us to test out these different projects within the organization. And in about 2015, we had just finished our first innovation project, and we were looking at health neighborhoods. And so what they were looking at is, again, public health, substance use, and mental health, and how that actually works. So from that, they kind of moved at, okay, let's create these, what they wanted to call them at that time were smaller health neighborhoods. But we kind of moved to a community-based type of project where we were looking at grassroots agencies that are already there, that are already doing the work, and they have this they already have the the love of the community, so to say, I'll say it like that, and the backing of the community. And so we wrote it like that, and we were looking for them to come in our 5 soup districts. Usually we do things in spas, but this time we decided to do things in our soup districts. And they would, at that time, decide on, okay, which areas are the most at need. And so with that, because it's huge. It seems like a small thing, but it's really a big thing, because we have 10 different strategies, 10 different agencies that we allow to come in, giving those agencies $2 million each per year to, and I think it's funded for 4 years, to come in and test out these particular strategies. So one of the strategies, which Eliza is a part of, is our Birth to 5 strategy. And again, going in and looking at ACEs, which is adverse childhood experiences, and seeing what can we do to, I guess, again, serve the underserved and the not served. And so with that, that's kind of how we, went in. And in that testing, we're hoping to, at the end of all of this, fund these types of services. These were not mental health services. They were totally different, and it was different for our department. Again, we fund mental health. And so how do you go out and you fund these non-traditional types of services to a community? But the community knew what the community needed. They identified it. And over the last 4 years, we've been testing it out with UC San Diego, and hopefully at the end, we can find funding to continue this type of work.
Thank you, Phyllis. And so it's not about creating new programs with organizations and groups that don't exist. It was really about looking at groups that have been doing the work. And I think you put it beautifully. They're loved by the community already, and that cannot be underscored enough. I'd like to bring in Jacqueline Chun, the Chief Programs and Operations Officer at the Deutsch Foundation, who has been supporting equity and racial justice work for a long period of time before it was actually popular to talk about equity, right? And we're doing that by supporting the creation of initiatives like Partners for Children South LA. Can you talk a little bit why, as a private foundation, you have invested in Partners for Children South LA, and how the initiative is centering equity and racial justice and your role, what you've learned from that as a funder?
Yeah, thanks so much. And thank you to my fellow panelists this morning and to the partnership. So the Carl and Roberta Deutsch Foundation, we have been an investor of Partners for Children South LA since its inception. And really, it comes down to a few simple things, and just building off of what Phyllis just left off on, and also what Casey mentioned around trust. And we see that solutions come from community, and we start from a place of trust. We don't start from a place of deficit that organizations and communities need to prove to us as a funder, as an investor, that their model or their ideas are of value. We come from a place of that they know what they need and that they have the solutions there. And so we start from there, and then we build from there around creating a true partnership. And what does that look like? It's being a thought partner. It's asking questions along the way, sometimes asking challenging questions so that you're prompting new ideas. And then other times it's being a cheerleader, because this work is not easy, and there are a lot of barriers to development and implementation and growth. And so it's being a cheerleader and supporter in the process. And then I would say the last piece in this element is patience. This has been years and years in the making. And we didn't imagine that our 1-year investment would change everything overnight. And we know we had a belief in the vision, and we knew that Liza and all of the partners, the founding partners, and all of those who have joined along the way and have experienced this growth in the organization had this vision. And we were there to support it and ask, what can we do to as a funder to support you in getting where you want to go, and also asking, where do you want to go, and what else can we do to support that? So I think it's always starting from a place of trust, a place of surplus, and knowing that that the experts are those who are in the community and live in community.
I'm getting goosebumps from hearing all of you, because, you know, it may seem like these are just words. The importance of investing and staffing, trust, right? Understanding that, you know, leaders have the experience and that they have been doing the work, asking critical questions, but also being a cheerleader. Because the work is hard, you know, addressing issues of disproportionality and structural racism. There is a real emotional labor that goes into the work that these initiatives are doing. And so you actually asked the next question that I have for the group, and maybe if we could hear from someone from AIM, and one person from AIM and one person from Partners for Children South LA. You know, where are you going from here with the initiative? What's next, and what's most exciting for your initiatives that folks should know about? And before the first person answers, I want to remind everyone in our audience, please write questions in the Q&A. We have one that will be asked after this discussion, but please ask questions. We have incredible leaders, and this is an opportunity for you to hear directly from them. So who would like to go first in terms of where the initiative AIM and Partners for Children South LA is going from here, and what you're excited about?
May I just start, even though I really do hope that Casey will jump in to talk about the Village Fund.
So Sonia, Liza, and possibly Casey, go ahead.
Okay, all right, then I'll be quick. So, you know, we talk about trust, and we talk about, you know, the other elements, especially that Jacqueline mentioned. I wanted to just emphasize one thing, the emphasis on partnership, really. And the reason why I appreciate Casey's engagement and involvement, and the Partnership for Early Childhood Investments involvement in the AIM initiative, is because they have come in, you know, with knowledge of the subject matter, you know, knowledge of ideas for interventions and engagement, and a commitment to culture, but a partnership that you can tell is an ongoing engagement. I met a funder just last week that reached out to California Black Women's Health Project. And as we were talking, I told the funder, I said, you know, I looked at your website, and because I didn't know they were actually a funder. I wasn't sure. I was curious, you know, and I said, are you a foundation or a funder? Or are you actually, you know, an organization engaged in the work? Because the website reflected the work that they are investing in community. And it meant so much to me to see that. And so I just think that, you know, as, you know, for the AIM initiative, you know, we have this Village Fund that is just this amazing, you know, opportunity to uplift community and to invest in really innovative ways and other community, like non-direct interventions that we would classically, you know, attribute to, you know, the maternal and infant, you know, mortality and disparities reduction, but respite type services and other things that can be done to address stress and to uplift Black women. So Casey, if you just talk briefly about the Village Fund, I just think it's such an amazing, like a part of the AIM initiative that really does speak to where we could continue to go forward if we were able to expand that.
Aurea, do you want to have Liza come in and then I'll follow up?
Sure. Yes, Liza, what are you excited about? Where's Partners for Children South LA going?
Well, I'm always excited. But right now, what I'll share is I think most people know that since our inception, we operated under a fiscal sponsor and we were co-located at one of our partner agencies. And this year, as of July 1st, PISLA is now a 501c3 and we're operating independently. So we're in the process now of growing our staff. We're searching for new office space. We're building our new board of directors. And just as importantly, we're preparing to launch our next strategic planning project. And I'm really excited about this next phase of strategic planning, as one of the big topics of discussion will be replication. There's been such an interest in bringing the PISLA model to other communities. Like, how can we ideally, right, via a private public community partnership, bring our early childhood system of care to other high need communities, East LA, the Valley, et cetera. We have demonstrated with our model that it's a cost-effective, efficient way for us to reach some of the most vulnerable children and families. Now, how might we share our approach, our tools, our lessons learned, and design and implement a plan that would allow us to reach more deserving children and families in LA County and possibly beyond. So I'm super excited about that. And that's something that we'll be kicking off at the top of the new year.
So on this panel, we have to celebrate Sonia's anniversary and Liza transitioning Partners for Children South LA from a fiscal sponsor to its own organizations. And what I have to say before turning it over to you, Casey, is that these initiatives were being led by incredible leaders, or are being led by incredible leaders, are doing important work that was always important. And it took courageous funders and allies like Parker and Jacqueline and Casey to be courageous to say these organizations haven't been received the recognition and the attention and support that they deserve. And Phyllis, and so we will be courageous and support so that they can have the resources to do the work and keep building. So Casey, go ahead, please.
Thank you, Aurea, and congratulations, Liza. I'm so excited for you and for the organization and for the work and for every community that gets to benefit from your model. I'm so thrilled. So congratulations. To the Village Fund. So this, I think, is one of the most important elements of our AIM prevention work. And admittedly, I will admit this, Sonia, you may not even know this. When we were first talking about the name of the Village Fund, I was a little bit nervous. I wasn't sure how that name would land with philanthropy. I was sort of more leaning toward, well, let's call it an innovation fund and so on and so forth. And, you all were very clear that, it takes a village and we need to communicate that in how we structure this fund. And boy, was it brilliant. So thank you, for even helping me to get over some of my hurdles with it. But really where we're going with the Village Fund is exactly as Sonia described. I mean, this is a vehicle that was a grant vehicle that was essentially designed by Black women in the work. And, we had a committee of individuals who we wanted to invite to the table to say, help us to design this pooled fund right. Help us to make it what the community actually needs. And sometimes we as funders have a lot of fear around that, right? Like sometimes we don't really know, how do we actually bring community into the process in a way that's authentic, and how do we not sort of set up false expectations? And sometimes we have a lot of fear around sort of processes around those things. But what I have found is actually bringing community into the design process is the way to alleviate fear from my perspective, because the pressure then is off of me as a funder to try to have to get it right. I don't know everything. I don't know what the community always needs, but they do. And so having this kitchen cabinet of women like Sonia and Winona and Brandy, like having this think tank of women to really spend 9 months with us You know, I always say we birthed a child in that period. They call it the Village Fund. And we're so grateful because now we're able to fund grassroots, community-led, community-driven Black women in community who are doing the kind of culturally responsive community work. We fund a yoga teacher in the first cohort. You know, someone who, as Sonia described, is providing respite care, providing the kind of stress relief that we know is essential to have a joyous and healthy birth. And so the fact that we have private dollars to do that means that we can provide a more robust village experience for a joyous and healthy birth. And so it is expanded. So now we are not only able to renew funding to the first cohort, but we just launched the second round of funding so we can fund a whole new cohort of organizations, and we bring them together in a quarterly convening so that they can network and get to know each other. And then the efforts around the Village Fund are expanding as well. So we're building, continuing to deepen and strengthen capacity in the communities, in the local community action teams. We're thinking about how we now develop a coordinated advocacy agenda so that these sort of grassroots efforts can come together, you know, to sort of garner greater strength at the policy advocacy level. So the work is growing. And really the sky's the limit. And when I was looking actually a week ago or so, Sonia, back at our initial, you know, sort of paperwork, you know, that our dream board, if you will, when we were first meeting and sort of crafting, the thing that I wrote, you know, in all capitals was dream big. That's what you all said. We want to be able to dream big. And so the fact that the partnership and with funding from the Department of Public Health through the state funding, you know, has supported the Village Fund as well. So the use of the pooled fund as a vehicle to help address some of those barriers to contracting, you know, that the county is known for. The fact that we're able to sort of position ourselves as a conduit to get resources out into community is another really important element. So the sky's the limit with the Village Fund, because we now have a vehicle where folks in community can dream big.
Thank you, Casey. Dream big. So we have a couple of questions, and because I want to make sure that we're able to answer the questions, but also that you are able to, you know, be a part of the conversation. If I don't call on you to answer the question, like, please let me know. I'd like to also speak on that item. I want to start with Dr. Allen. So one of the questions that was asked by the audience is, sorry, let me find the question. Dr. Allen, might you speak to how the department became open to working more closely with philanthropy? What kind of culture change was needed from the public sector? So if you could talk a little bit about just the culture change and how the department became more open to working more closely with philanthropy, because we know there is a lot of bureaucracy and red tape, right?
Absolutely.
And that can be challenging.
Yeah, I mean, believe me, it's challenging for us too. I mean, it's not as if we're immune to, we don't have a different metabolism from the rest of the world. I think, so early on in the process of developing AIM, we did a series of community meetings, and at each of them, there would be people in the audience who stood up who weren't asking for money, but were saying something like, I'm a psychotherapist, I serve Black women and, you know, families, and I really regret that I can't serve people whose insurance doesn't cover what I do. Or, you know, yoga teachers, or Sonia and I had this archetypal example of a woman who braids hair, and she does it for money because she has to survive, but you know, it would make such a difference to women who couldn't afford it. And heard that time after time, and then thought, all of these people are doing our work, but they are doing it unrelated to this sort of, this sort of broader definition that this is about. And they are not seeing themselves as people dealing with infant mortality and equality. There's them seeing themselves as people providing a nice service. And so came back and talked to our AIM partners about the idea of developing a fund that would support them. And I think it was the recognition that we wanted to support not what we were telling people to do, but what people were already doing. They didn't have to change a thing except for seeing themselves newly as part of this major social effort. And clearly the county could not do that. And it was really fortuitous that when we were invited to speak at, with the partnership 3 years ago, I met Casey, and Casey and I talked, and she really became involved. And she was the one who translated this idea into this viable effort. But I think it was that notion that we needed a way to fund these small community efforts that made us reach out and find a real phenomenal partnership there.
Thank you, Dr. Allen. So there's a different question that I'd like to pose to Jacqueline. One of the persons in the audience is asking, what do you do if you didn't have a community, partner at the onset of a public-private partnership? What advice do you have for how you can bring community leadership as partners to this circumstance?
Yeah,
and others can also speak on it, but if you can start us off, Jacqueline.
Yes, absolutely. That's a really great question, because we also at the foundation have invested in other opportunities that didn't start with a community partner or partners. And so we actively outreached in community and sought out the voices of providers and asked them, what is the need in this community? What is not being funded? What are some of the gaps that are that need some continued support and have been overlooked, and brought together focus groups through the help of consultants, focus groups to also speak to individuals in the community, not just the providers, and ask them the same questions. And what would be most helpful if philanthropy came into this area or this area of work, and what would support you in being able to advance this issue. And so after identifying those greatest needs or the gaps, then inviting organizations who expressed interest. Would you be interested in doing this work if you were to receive support? And would you be interested in working with others alongside you to support a greater effort, if it's outside of your region, but more like countywide? And so I think starting, again, it always just starts at the place of community. And so whether it's already there or you go and seek out and ask community what is needed, what isn't supported, what is supported, but you need more innovative dollars. But always starting there, community is at the center.
Thank you. So there's a comment that I would like to read to everyone. And it's, I would love to hear any tips of how CBOs can communicate their models to funders in a way that will create trust, respect, and continued funding. And so is there anyone who would like to speak to that? Liza, Sonia, Phyllis, or a funder?
Liza, do you want to go? Because I can certainly address this, but please. Okay. The communication of your model of service to a funder, has to be done with an appreciation and respect that you really do deserve the funding. You are doing the work. If you are actively doing the work, in many cases we do have, evaluation of our work, but in some cases you don't have, the formal evaluation of what you're doing. I mean, the evidence is there, in the storytelling. The evidence is there in the lives that you are touching and changing. The evidence is there when you, in our case, we train Black women to be community health advocates and activists. And when we hear those stories back from them, that they were able to help someone navigate the healthcare system, because that's really one of the major challenges is navigating a system, that is not, necessarily set up to provide a level of care and service. So communicating that to a funder, has to be done, through, yes, that conversation that you have with a funder, but also documenting those stories. Having those stories available on a website, having those stories available through newsletters, and being able to demonstrate that the work that you're doing in community is necessary and it deserves an investment. It deserves an investment. And I did see someone mentioned, what about the possibilities of bringing in the corporate sector? And, I think that that's critically important as well. I mean, that is also, an intersection where, in some cases, the things that we experience, from the corporate sector are causing some harm. It could be environmental, it could be, the ways in which we, have, proper foods available in our grocery stores, a number of things. So, we are filling those gaps as well and helping our communities, to find protective factors. I mean, we believe very strongly in culture as a social determinant of health, particularly a social determinant of mental health. And so when you're addressing stress and when you're addressing, chronic psychological issues and social issues, you're doing that, around utilizing cultural practices, community to define practices. And so letting a funder know, this is in our community, this is how, we institute change. This is how we bring about change. This is how we work with our communities to bring about that change. And it's not scalable, without intentional investment.
Thank you so much, Sonia, for speaking both to, the question about, how to introduce your organization and your work to a funder, but also responding to the question of, how do we look at corporate support as a part of, the larger community. And I think I would add, and Casey, I'm going to ask you a question and then you could also speak to this one. But I think I would also add, when I think about Partners for Children South LA, started as 4 organizations, grew to 6, and LISA 38. And I think that part of, raising funding and gaining long-term support for the work is also about building deep partnerships with organizations that are doing the right work, the important work, because those organizations will lift you up in terms of the critical work that you're doing and really resource the work together. And I don't know if you want to just add anything to that, Liza, otherwise I'll go to Casey.
Yeah, just very quickly for the question that was just posed, I just really want to also add to all that Sonia shared is what I think helped get Partners for Children where we are today, where we actually can celebrate all of these amazing accolades is something that Jacqueline hit on earlier, which was patience, right? And what I always felt comfortable doing with Jacqueline and many of our other funders is just being transparent, right? And I don't know why I'm getting emotional, but being able to be transparent, be vulnerable, talk about this didn't quite work out the way we had hoped, so we're gonna make a pivot, and them trusting us enough to go along for the ride, right? And I think that if they had given up on us sooner, we wouldn't be celebrating all that we are today and being a force for change in South LA. So it's really building these strong relationships with funders, being very transparent and feeling comfortable to say that things didn't work out okay, but you're going back to the drawing board to come up with a better plan, a new plan, that again remains focused on the population that you're serving. So I just really wanted to elevate that, because without that, honestly, PISLA wouldn't still be here so many years later. So just really wanted to highlight that. The Deutsch Foundation is amazing, but there are many other foundations who have a similar approach. And it's that innovative thinking, I think, that has really helped so many nonprofits flourish.
And true partnership, right? True partnership acknowledges that when you're working with community and addressing decades of structural racism, right, that there's a lot for us to learn, and that sometimes taking risk or failing is what we have to do to be able to meet the needs of our community members. And so, Casey, before you answer, and I see that Phyllis also wants to join the conversation or answer this question, someone would also like to know what the biggest success in bringing outside funders to fund this effort, especially as an issue area that they may not know anything about. So if you can tackle both of those, and then Phyllis will bring you in.
Sure. And I was just going to say it's now officially a Liza Bray panel when we've got some tears, because I know Liza always brings all of her heart and emotion to the work. So we're now official. I was going to say, and I would be absolutely remiss if I didn't answer the former question and the question that you just raised, Aurea, if I didn't bring the partnership founder, the late, extremely great Richard Atlas, into the space. Because Richard would say, to the question about how do we make it make sense for funders, he would say to his peers that he spoke to in workforce development, who said, oh, well, we fund workforce development. And he would say, I do too. I just fund it from the earliest part of life. Richard would say to, funders who said, well, we fund, K-12 education. Richard would say, I do too. I just fund it from the onset of life. And so for us to be able to see our work, sort of connected to this broader sort of life trajectory is so important. And so what has been the benefit of bringing private funders who really haven't, necessarily seen themselves in early childhood or necessarily seen themselves, as part of the AIM work is just that, is that we are saying to them, this work is part of a broader life trajectory. So you may be funding, Sonia to do work, to do XYZ work, but that's not the only work she does. She's not only touching, women who are pregnant and expecting their children, she's touching other elements of their life. And so the greatest benefit, I think, is that we've been able to expose funders to these organizations and leverage dollars for them for other pieces of their work too, because they are working in the space of early childhood, but they're touching families, they're touching the full trajectory of life. And so to me, that's been one of the greatest benefits of this work.
Thank you, Casey. Thank you for bringing Richard Atlas's just love for our community and the authentic relationships that he built with many of us from the beginning. Thank you for doing that. Phyllis, would you like to answer to either of these?
Yeah, just really quick, and it may not have anything to do with the question, but being brought into the panel, this is my first time just even being a part and exposed to philanthropy, and my daughter wants to be one. So, but when I was thinking about it, I'm like, okay, what is this, right? It's a desire to promote the welfare of other people. And in that, you're funding that. And so when I thought about our project in DMH and what it was that we were trying to do, and again, we were looking for these grassroots people who are already there doing this work. And what we wanted to do was promote the services, again, of preventing trauma if we could. Right. So again, we weren't looking at mental health. We were looking at the trauma that these communities were exposed to. And that's what we wanted to kind of focus on. And so in that, who is better to outreach and have the capacity to do so, again, are those Lizas, the Sonias who are already in the community, again, who are already attached to that group of people. And then also a part of what we were looking was, how do we look at some of the stuff that we don't want to. Again, we talk about attacking and touching discrimination, right? And stigma and all of those things. So in our project, that's what we want. We wanted to really look at what are some of the things that are really racism. We for our department, we really jumped into that and we started having conversations around that and allow those conversations to be open in those communities. And so there were some hard conversations that came up in some of those things. Even we had some of our smaller providers come in and say things that we had not heard as a department. So I think in doing that, and then also when we allow that, and again, allow these others to come in, you're reducing the disparities, because that's the whole goal is to reduce those disparities. So for me, as I'm listening and thinking about what we can do to help. I was an advocate for the project. And I wanted this project to move forward. One, I was a person in the system. Two, I was a person in the community. And then I also worked for the system. And so for me, I'm like, okay, how can we do this? Because I know if we do it, and for us, we're testing, we're saying, if we do this, can we change our DMH system to fund these types of things? And so that's what we're hoping through all of this that comes forth, that we not only as a large mental health agency testing this, but also writing this into our everyday work. And so again, those communities that are, again, like I said earlier, who are not served, and those underserved can be served more by, again, the Lizas and the Sonias and the others that are doing this work in the community.
Thank you, Phyllis. So before we hear final reflections and thoughts, maybe something that we haven't shared, Phyllis, you just brought in the community, and Liza, I'm wondering if there's a story of a family that PISLA, Partners for Children South LA, has helped that you'd like to share with the group, and then we will open it up for just final reflections, comments from everyone on the panel.
Yeah, you know, that's a very dangerous request, but I'll do my best to be brief and not shed tears. It's so funny, the first story that popped in my head was, interestingly enough, it was the last story that I told Rich Atlas. So I'll quickly share it. We don't normally work on the weekends, but the work never ends, right? And one Sunday, I'm leaving my mom's house, headed home. I'm driving down Vernon Avenue in Spot 6, and I see a woman and a child in a car. And normally you wouldn't just approach, but in that case I did, because I could tell from the car it was loaded up with suitcases and things of that sort. So my initial thought was, it's a homeless family. So that's what Liza does. She just shows up with folks' cars and she wants to see if she can help. And that was indeed the case. It was a single mother of a 3-year-old who had relocated from Las Vegas. She was fleeing a domestic violence relationship. And I knew we could help her. And immediately we went to work, and I put her in a motel that day so that we could get to work the next day on Monday. She shows up at our offices, and we enrolled her in the PISLA system of care. She needed housing, she needed childcare, she needed employment. She didn't have the resources to acquire the documents that she needed to get her daughter enrolled in childcare, and she needed a medical provider. Through the PISLA system of care, we were able to support her with all 5 things. Mom didn't have to figure out where to go, start vetting organizations, who to call. Through our system of care, we were able to immediately get her linked and initiate the process. And I volunteered to be her primary care coordinator. And we were able to immediately get her placed with a few phone calls and asking some favors, got her placed at Gramercy Place with people assisting the homeless, got her employment where she's still working at a downtown architecture firm. Her daughter was enrolled in childcare through the support of Crystal Stairs. St. John's became their medical home. I could go on and on and on. And that is just one success story. And this young mom and daughter are still in my life. I became like a mentor to them. And that's what PISLA does. It's about creating easy access to some of the critical services that children and families need and deserve. I always say deserve because they deserve it. That's what we do. And that's one of the last stories I told to Rich Atlas.
I have so much love for you, Liza. You always center the heart of our community, the women, the children, the teenagers, that deserve all of our attention and our support and our love. And I thank you for that. Before I ask for final reflections, I want to take the liberty as a panelist to just leave everyone with a reflection point. And we work closely with Dr. Cheryl Grills, who's a clinical psychologist and a tenured professor at Loyola Marymount University. And she often reminds us of an African proverb that says, if you want to go quickly, go alone. If you want to go far, go together. And I really believe that all of the women leaders on this panel have demonstrated the strength and the power of moving together. And so with that, if we have a few minutes for final reflections, points that you didn't have an opportunity to lift. And so I will open it up, and if you can, quickly share your reflection. We have about 3 minutes to wrap up.
I'll start and keep it very simple and say that public-private community partnerships are the model of the future.
I'm happy to jump in following Casey and building on what she just mentioned. I think as a funder, think of this, your partnerships as a long game. It's, sometimes oftentimes actually, progress is not a straight line, and you need to provide space for discovery. And then something Liza mentioned earlier about, this didn't work out and we had to pivot. It reminded me of a book that I would read to my son called Beautiful Oops. And sometimes things happen and you find something better as a result of things not going your planned way. And so allow moments for beautiful oops along the way, and always center community and trust in all of those relationships.
Dr. Allen.
I think it's very important for funders to understand that you bring your money, but you also bring your gravitas to the partnership. And part of our message in AIM, and I think this is true of the partnership for children in South LA as well, is that we're really trying to change the world. Whether we're doing it one by one, child by child, or doing it policy by policy, we're really trying to change the world. And it's an undertaking that really requires all hands on deck. And we need you. We need not just your money, although that of course does wonders, but also your buy-in and your name. You lend a sense of shared commitment that is required by these initiatives.
Thank you, Dr. Allen. Phyllis, are you ready?
I think for me, the biggest thing is, in what I've learned from the project period, is just learning and having the ability to learn, continuing to learn about what we can do, what the community can do, and how we can actually do all this together.
Liza, would you like to add a final point?
Yeah, I just want to echo all that's been shared, but add that I'm just inspired by this conversation, and it really keeps me hopeful for the future, right? And I'm just really looking forward to what's next with all of our work, and just having just more voices at the table.
Thank you, Liza. Sonia, please close us out.
Yes, certainly. This has been such an amazing time together, and I appreciate all of you so much. The California Black Women's Health Project, interestingly, is not actually funded as a part of the AIM initiative. We are not, our work is in this space is our investment in the community, public, private partnership. This is our investment in lending our voices, to this space. And we find it absolutely critical that collaboration across all three of these areas is intentional. And it means everything to me as a leader of the organization that, we are in spaces where our voices matter. That's really what it is. Our voice, we reflect the voices. We always say Black women speak to us as an organization and through us. And we reflect those voices, and we are, so grateful to be a part of the AIM community and to meet Liza and the work with PISLA. And I look forward even to an opportunity for us to collaborate. And so thank you all so much. And thank you, SoCal Grantmakers, for the opportunity to be in this space with you today.
Thank you, Sonia. And thank you all for inviting me to moderate this panel. I'm honored. I'm thrilled. You are seen. You are brilliant. You are courageous. And for folks who joined us today, I hope that you can think about your role in both helping to amplify, but also helping to bring greater investment to organizations, communities that have been doing the right work by centering equity and lifting up the most important individuals in our community, women, children, families. So with that, Parker, thank you, and I'll turn it over to you.
Thanks, Aurea, for brilliantly moderating this discussion, and to all of our panelists. Liza, I had to go off screen there. I was tearing up. I'm still sniffling from that story. But in all seriousness, thanks to all of you. As I sit here, one of the things that really strikes me is, we're talking about systems change and it's complex, but what I hear from all of you is how important the human connection is, the relationships are, that the cultural differences between how community thinks and speaks and talks about this, and philanthropy and the public sector, can only be bridged when leaders like yourselves come together to have those conversations and to learn and listen to each other, and then create a culture that is a shared culture around meeting the kinds of goals that we're collectively aspiring to meet. And it's really a moving conversation, one that I know we will continue in the work that you all are leading, and that we'll come back to this again, because this is not a check the box kind of conversation about public-private community partnerships. So again, thanks to all of you for your wisdom and your time and leadership on this, and to all of you for the great questions and comments that came in the Q&A box and the chat box. We will share a recording of this conversation. So if you want to go back and see any part of it again, if you just need to cry again, you can go watch Liza's story. And if you have colleagues who couldn't make it, you can share it with them. So thanks everyone so much for joining us. We'll share what our January meeting will be sometime in the next couple months, and have a wonderful rest of the day. Take care, and we look forward to being with you in community again soon. And as someone just put in the chat box, so importantly, go Dodgers. Have a great day, everyone. Talk to you soon.